ADHD is no respecter of gender, but historically it has been considered a male disorder because that's when it was first studied, was in boys and males. And just to throw out a little fun piece of information, it's been studied since the late 1700s. So mostly the condition had to do with little boys who were wiggly in classes, or they didn't live up to their potential, they weren't showing their academic potential, and that's how it got. It was defined by those types of behaviors.
That makes sense. That makes sense, because that's kind of how I heard about it, early on as well. But that is not really the case, especially when we start thinking about how it impacts women. And let's talk a little bit about that. What's some of the biggest misunderstandings in regards to the disorder in women?
Well, if we start with the woman, the female in her adult years, the misunderstanding may be that she is depressed all the time just because she's a housewife. Or a misunderstanding will be, well, she's doing the best she can. Maybe she is not living up to her potential, but that's not as not as much of a push. She may be a housewife that her house is disordered and people think she's lazy. And she may be, but she may be a person with ADHD.
How can you tell that? What do you? Are there some signs that you can tell that in either yourselves or other people you come across? You as an expert probably see it a lot easier than us lay people.
Well, yes. I think when I talk to women and they talk to me about their lifelong issues of disorganization and problems with time management, relationships for women, females with ADHD can be a very difficult situation in, marrying the right man or going with the right boyfriend or having the right life partner. And we find both male and female take risky behaviors, but women take a different type of risky behavior. And then they start to pay the price for it when they get older.